So what we're doing today is we're getting a large portion of our medical teams trained up in veterinary CPR. The veterinary CPR program that we're using is called Recover. It comes from the Recover Initiative. My name is Nicolette Zardet. I am the medical director for our Mission Campus Hospital. I am also a certified instructor for Recover. What we're trying to do here at the SPCA is get all our medical teams on the same page when performing CPR on our canine and feline patients. The process for this training was that everybody who participated in it first went through about 9 hours of online trainings for BLS and ALS, so basic life support and advanced life support. We had about 50 staff members that did all of the in-person training, and then a whole other set of staff who just did the online training as well. We started out with a short lecture with slides as well as interactive discussion. And then we quickly launched into working hands-on we had some fake dogs and cats. And so we used mostly inflatable mannequins, and then we also had some of our own stuffed animals. Another great benefit of this was that we were able to bring together teams from different departments. So people who work down the hall or in a different building, who maybe they don't know as well and haven't had the opportunity to work with as much, and getting those groups together has been a really tremendous opportunity for our staff members. Once we were done with the basic life support, we moved on to working on advanced life support. We actually switched gears and started using what's called a simulator, or SIM. This simulator was brought actually by Ken Yagi, the program director for Recover. The SIM has a lot of bells and whistles on it, basically, that actually you can detect a pulse, and you can listen to the lungs, and you can place an IV catheter, and you can intubate. What this does is it provides a much more real life, or closer to real life, experience for our staff. When they are confronted with a true live patient, it feels much more familiar to them. They can rely on the training that they had here in the workshop and work much more successfully together as a team. As you can probably imagine, this was a big investment by the organization to get all of these staff members trained up. To me, it speaks a lot about the vision of our organization in supporting this work and in making this investment in their employees. Having everybody trained in the same system can definitely improve outcomes and can also lead to better team dynamics, both in a CPR situation, but also in all of our clinical work. If we can have actually a evidence-based methodology that's robust and can be successful, and all of our teams are trained and aligned on this method, then we have a better chance of getting those patients back. And that's why we're doing this work.
She's like